All right, there we go. Got me unmuted, I think. So I kind of changed up the topic today because we've already done the previous topic the last time I was here. So welcome. And I do like to know what field you're in, whether it's nursing or PT, whatever, social work, whatever, just so I kind of know I can gauge which direction I should go with the talk a little bit. This one's probably going to be a little bit short and sweet. Um, it was fun for me to do because I probably treat loneliness a lot on a day-to-day basis, but maybe didn't recognize it and never officially screened for it. And then I learned a lot going through the literature about what I was doing well and probably not so well based on the literature. So this was kind of a learning experience for me. So that was good. Um, let's see. There we go. So I'm just going to define loneliness and loneliness versus social isolation, which are kind of different things, but I'd probably treat both and reasons why it matters to kind of identify and treat. And then what are the treatment options? So hopefully that's what we can address today. Like I said, it's probably going to be short and sweet, and we can have time for some discussion. So hopefully you guys have some patients that you've kind of identified and treated and things that have gone well that you can share with the group. I found this quote when I was looking, which may be a little bit extra sad knowing that he did commit suicide. But his quote is that I used to think the worst thing in life was to end up all alone. It's not. The worst thing in life is to end up with people who make you feel all alone. So that's pretty sad, but I think it points out how you can be lonely even if you are surrounded by people. So the various definitions of loneliness out there, I mean, it's pretty self-explanatory, right? It's an unpleasant experience that occurs when a person's network of social relations is deficient in some important way, either quantitatively or qualitatively. A discrepancy between an individual's preferred and actual social relations, so a negative experience of feeling alone or isolated, even when among family or friends. Feeling alone does not necessarily mean being alone, nor does being alone mean feeling alone. It's a deprivation in meaningful interpersonal relationships. It's subjective perception of missing social contacts or a designated companion. So I think the big difference between loneliness and social isolation is loneliness is subjective and you can still be surrounded by people on a regular basis and experience loneliness, but social isolation is the objective lack of social contact with other persons. So somebody who's truly isolated and not around people on a regular basis. I think the trick is trying to figure out who that is socially isolated is actually experiencing loneliness versus what they always tell you in a clinic visit is that they've always enjoyed being alone. They've always been alone. And so they don't feel like it's affecting them. So I think it's hard to kind of distinguish between those people who, yeah, you're telling me that, but is that true and or not? So quite prevalent in our country and around the world, especially since COVID, right? I mean, we did this intentionally. And as I find, there's a huge population of people who aren't coming out of it, who aren't getting back out into the world, who are staying very isolated. And so it affects over 40% of middle-aged and older adults in the US. A quarter of adults aged greater than 65 are considered socially isolated. So they may not be lonely, but they're isolated. 12% of older adults worldwide, prior to the COVID pandemic, has risen to 28.6% during the pandemic. And who knows, how accurate this is. I think probably we don't look for it, so you can't, if you don't look for it, you don't find it. So is this number really significantly higher? What are risk factors? Or loneliness is a risk factor for certainly depression, So this one's kind of the chicken or the egg, which came first, right? I think you can be depressed and then experience loneliness, but you can also be lonely and then experience depression. You're at risk for suicidality, alcoholism, cognitive decline, and dementias. And I think I'd probably really highlight on this one because I've seen that, right? We've seen it as a nation after COVID. Tons of people have been diagnosed with mild cognitive impairment and dementias coming out of it, and that is because of the isolation. Cardiovascular disease, which I found interesting when I was going through the literature, that loneliness is as big a risk factor for having a heart attack and stroke and morbidity, mortality from that, as you would say smoking is, or inactivity, or obesity. So it's right up there with all the common causes and risk factors, and we don't really think about it that often. Certainly, people who are lonely have an increased health service utilization. They're more often in the walk-in clinic, the ER, their doctor's office. They have decreased immunity, and the reason that is proposed for decreased immunity and increased morbidity and risk factor for heart attacks and strokes would be the increasing the adrenocortical activity and increasing inflammation. So if you're lonely, you have higher stress hormones going throughout your body, and that's thought to be the reason that we have increased morbidity, mortality. People who are at risk of becoming lonely or experiencing loneliness would be those who are widowed, generally female more often than males, older age, people with multiple chronic diseases, those with decreased mobility, lower education, and lower socioeconomic status have been found to be associated. And I think that in my practice as a geriatrician, probably the biggest thing is people stop driving. And so then they can't get out. It's harder to make an effort to get out and see other people, or they feel bad with their multiple chronic diseases, and so they don't get out. They're tired. So we see this a lot, especially the older people who don't want to leave their home. So they'll be alone in their home till they die. That's what they tell you. That's what they want. Yet they're suffering from loneliness. And so it's really hard to kind of reason with these people to help them understand that maybe a change in their environment would do good. And so often after people who want to stay in their home move to a senior housing or a more social housing situation, they all come back generally to me and say they wish they'd done it sooner. So it's hard to get from the stage where they never want to do it to where they've done it and are happy about it. So if anybody has any ideas on how we help have those conversations, I'm up for listening. So there's tons of loneliness scales out there, and there's been lots of meta-analysis and reviews, and it looks like the one that usually comes up as probably the best, most commonly used loneliness scale is the UCLA Loneliness Questionnaire. And so it's used in studies about loneliness, but it can be used in clinic. It's fairly short. It shouldn't take you too long to do. I honestly have never done this before. But ask questions. How often do you feel that you are in tune with people around you? How often do you feel that you lack companionship? How often do you feel that there is no one you can turn to? How often do you feel alone? How often do you feel part of a group of friends? How often do you feel that you have a lot in common with the people around you? How often do you feel that you are no longer close to anyone? How often do you feel that your interests and ideas are not shared by those around you? How often do you feel outgoing and friendly? How often do you feel close to people? Left out? Do you feel that your relationships with others are not meaningful? Do people really know you well? Do you feel isolated? So you can, see, they're good questions, and I probably will start using it in my clinic much more often since kind of doing research and looking into this topic. I know that this is the scale, is it Jeremy? I think Dr. Geriatric is on there, that Jeremy does for his project where he reaches out and he does kind of a reminiscent project. And I'll talk about that a little bit later, but if he was on, I'd certainly like his views on this. So that brings us to interventions, right? And this was intriguing. Certainly physical exercise was found to be very beneficial to the feeling of loneliness. And the interesting part is it doesn't have to be group exercise. It could be going on a walk by yourself improved your feeling of loneliness. So exercise, obviously it's it's decreasing stress hormones, it's increasing dopamine in the brain. So I'm guessing it's through those kinds of networks that it's improving your experience of loneliness. Reminiscence therapy. So, looking at old photo albums. And this is what Jeremy and I don't know if Jeremy's on, but Dr. Geriatric, can you talk about his reminiscence therapy project? You're in the car, so I don't know if you can click over very easy.
Can you hear me?
Yep.
Okay, yeah, I guess I can. I just got to hit a button here, but yeah, I mean the reminiscence therapy is featured through a variety of programs, and basically some of them are intergenerational, and so that's one of the aspects of the UND-based TeleECHO program. It basically matches up a student, either undergraduate or graduate student, with an older adult. And there's a set of questions that are asked of the older adult, basically tracking from their childhood through their current life situation. And there's a back and forth, and basically at the end of an 8-week session, the older adult gets a booklet, which is, basically a autobiography. So it's their story, and they get a reporting. And one of the things that occurred through the University of North Dakota program in geriatrics was enhancing this booklet with photographs. And so, imagery that helps people reflect, particularly those that have memory loss. Sometimes the photographs are a little bit better of a bridge, for their memories. And then sometimes, not that we've used this in the program, but music can be an important bridge for consolidating memories. So that there's different little tweaks or augmentations that can be used to enhance the storytelling and to make it more meaningful for the older adult. So and it does show preliminary data, for this TeleECHO program shows that it does indeed reduce loneliness. And yeah,
he's using the UCLA scale, so also I believe so.
Yeah. And there was a new one that came out. It's called, I think, Alone. I don't know if you came across that one, but that's kind of an even a more modified version of the UCLA scale. So
good.
People keep thinking about this. Yep.
Other things that have been shown to improve feelings of loneliness have been FaceTiming, video conferences, even just showing videos of family members that you'd pre-recorded conversations. Those kinds of things certainly improve the feeling of loneliness. Living arrangements. So, like I said, getting people to move to senior housing where social life is kind of right at your doorstep. That's probably the one I try to steer people to the most, but it's the hardest to convince people that don't want to leave their homes. Animal therapy, and the people who are in long-term care, this is what's been studied the most in long-term care facilities where there's loneliness. And so these are some of the most positive studies for improving loneliness is animal therapy. And again, even when the animal therapy is not with a group of people, even if it's just you and the dog in your room, experience of loneliness is improved. Or I guess it doesn't have to, the cats too, I suppose, have been studied too. I'm a dog person, so that's where I go. But for sure, this is one of the most positive things out there. So if anybody has experience where you've seen examples of this in the long-term care way, I'd love to hear your stories. Otherwise, counseling and cognitive behavioral therapy, it can improve feelings of loneliness and social. Actually, this is what I probably have done the most in the past is social prescribing. So generally I say you need to get out and about with people. Often we try to come up with something that pertains to them. So besides going to the senior center, go out to the art, the local art what is our thing, museum or whatever that pertains to their interests, but apparently social prescribing has not been found to be beneficial, and they think that that's maybe because they don't necessarily build meaningful relationships. So that one's probably a plus or minus, but not as beneficial. And darn it, that's what I've done a lot of. So I'll have to change what I'm doing. So I have a couple of patients that I can give examples of, and we can go through, and then hopefully some of you have somebody you can think of that just something that we talked about or something even completely different totally improves somebody's feeling of loneliness perceived by you or by them. So this is kind of I see this kind of patient here every day, probably. 88-year-old white female who's widowed, a history of osteoarthritis, hypertension, osteoporosis, presents for her regular 6-month follow-up of chronic disease management. She lives alone in her home and recently self-stopped her driving because she just didn't feel comfortable doing it anymore. Since then, she's noted a 10-pound weight loss from her last visit, and family notes some changes in her memory where she's forgetting conversations that they just had. Because she's not driving, she's not going to church, and she stopped playing cards with her girlfriends because she didn't want to be a bother. She didn't want to make anybody take her. She didn't want to be a bother to anybody. She's not sleeping at night. Her daytime is spent watching TV. She's reading and often finds that she's fallen asleep during the day. And when we're talking, she even admits she thinks she's falling asleep just because she's bored and she has nothing to do. So this is like so many patients. And so what do we talk about doing? I think one big thing is the weight loss, probably for many reasons, right? When you're alone, you don't want to put the effort in to cook for yourself. So you're not cooking good, well-rounded meals. But we are social people, and so often the first thing that I recommend is social meals when somebody's losing weight. How to get that is a different story. It can be hard, right? If they don't have family around who are willing to pop in for meals, it can be difficult. So, but that's important for gaining weight. And then also for her feelings of boredom. How are we going to get her something to do? She's certainly, and like I said, at the time I didn't do a loneliness scale, but we certainly determined she's bored and lonely, right? By just talking with her. So I recommended that she move to a senior housing facility so that she could have activities just at her doorstep so that she didn't have to worry about finding a ride. We also talked about how people don't mind giving you rides and we should ask for that anyway, right? But that's harder to change those kind of perceptions and feelings. I got a social worker referral so that she would have other options for rides. And they gave her all the living facility information for senior housing in the area. And this was when I was prescribing increased social activity. So I said, you need to get out and do things. And I think with this particular lady, we talked about the senior center and going there to play cards or just asking her friends to get her back into her normal previous card game. At 12 weeks follow-up, this was somebody I did convince actually to move to a senior facility where she's independent and she's eating social meals and her weight is back up. She's enjoying activities. She's getting out and playing bingo and she does coffee with the ladies in the morning, and her family does note an improvement in her memory and thinking. So that's certainly one example that I have of kind of intervening with loneliness and improving this patient's quality of life. Just recently, after writing this talk, I saw a lady back for follow-up. She's also in her 80s, probably 78, 80. And we've seen her, and she came to me with concerns of changes in her memory and thinking. And we did a slum, so the St. Louis memory screen, and she scored a 24, which is mild cognitive impairment, kind of borderline mild cognitive impairment versus mild dementia. And so we were focused more on her memory, but we talked a lot about what is she doing with her day, and she's not getting out, she's sitting around, and it's just because she hasn't made the effort since COVID and things opened back up, right, to get back into her previous activities. And so we talked a lot about those things. We talked about how you need to exercise regularly for improvements in your memory. And I just saw her in her follow-up visit, and she got a trainer. So she started going to a gym, seeing a trainer 2 days a week, and then joined the Silver Sneakers there for the other days. And at Silver Sneakers, it's a group of ladies just like her, and they formed a friendship, and they gather before Silver Sneakers and sometimes hang out for lunch after Silver Sneakers. And she was just a totally different person. She was more active, engaged, she had more energy, and she was just so excited that she was feeling better all around. And we did the slums repeat, and she scored a 29. So the max is 30. So she's essentially normal. So that one was just a really, really fun to see how getting out and getting exercise plus finding some friends really improved her entire life. So anybody out there got some long-term care examples or other examples where they've seen loneliness? I think one other thing I would say, and it's probably when you need to do the loneliness scale to try to determine, because so many people say, I've always been somebody who likes to be alone. I run across this a lot. When I say you're at home alone now, how often do you talk to somebody in person, or how often are you interacting with people? And they say, not very often, probably never. In a day, I could go a whole week without seeing somebody in person. And they say, but I've always been a loner, right? That's their response. And I try to remind them that, but they had a companion, so they were married, and now they don't have that person that they're interacting with every day. Or they had children, right, and they were interacting with their children every day. Or they had a job that they went to, and they were interacting with all those people. So you may have always thought of yourself as a loner, but in your previous earlier life, you had a lot more interaction with people than you do at this time. And so sometimes I try that to get them to realize how really this is loneliness, social isolation, and is probably contributing to how they're feeling, versus being a loner and an introvert, which I understand, right? I would probably try to say that too, but then I think about my life, and I see people, every day, multiple people, and so it's different. And it's I think you have to somehow open their eyes to how it's different at this time in their life, since they're, widowed now and they are living alone, that how long can they actually go without interacting with somebody? And that can be a big difference than saying you were a loner always, right?
It looks like we've got a comment in the chat. Dr. Dahl, Mabel said, I've heard of OTs working with this population, creating gardening groups.
That would be fun. And I think the other thing is helping them to understand that other people are out there their age that are experiencing the same thing. So why don't we all get together and relieve those feelings, right? But it's getting the effort and how do we get a ride, and those things certainly make it more challenging, right? And I always think of how difficult it is to make friends. I think it's really easy to make friends when you're going to school. It's really easy to make friends, through different stages of your life. And then there comes a time when I think it's really hard to make friends. Um, and and it's a time when lots of your friends and companions are dying, right? Or getting too sick, or some things are happening and you don't get to engage with them. And so yes, it's hard. It's hard to make friends for sure. So how can you put yourself in an environment that it makes it easier? And I just see a lot of benefit in moving to these senior places where they have activities going. At least now again they are. So that's a good thing. But yes, short and sweet today. I don't have much else for you. But I think it's obviously, I mean, to know that loneliness is as big a risk factor as obesity and smoking is to your morbidity and mortality, I think is eye-opening and huge, right? We need to be evaluating it, looking for it, addressing it. And our geriatric population is at a very high risk. I'm sure I'm sure teenagers, there's a big risk too these days, with feeling lonely, even if you're on all the social media and stuff too. But in my world, in the geriatric world, I think it's very, very big deal. And hopefully we're just kind of watching out for it and trying to get people to think about it in a different way and do programs like, whether you have the pet therapy dogs or exercise, how can we get more of these types of programs? Gardening, that's awesome. To help with this population in our areas. I don't know. If anybody's got anything out there, let us know.
Any questions or comments, certainly can be put in the chat or just unmute yourself and feel free to ask any questions.
Hi, this is Mabel.
Hello.
One of the other things, both my parents live in senior housing. One of the things that they've actually made to help seniors get out, who sometimes don't even go to the community room, is when they actually put together and they have a public school bring some young people into the community room and they start to have conversations with them. So they'll assign some children to different seniors and they'll have coffee and cookies and they'll get to tell their story, whatever it is that they want to share. And I think that that's been interesting to be able to get some of the seniors out.
And I think how important that is for the young student as well.
Yes.
For sure.
Mm-hmm.
I think we should do more of that. And there's tons of studies where they have long-term care and preschools in the same area, or daycares, and how beneficial that is to both parties.
Mm-hmm.
How many do we have long-term care? I didn't even get to look who's out there. Or hospitals allow kind of pet therapy to come in. Do most places have a program?
This is Lee with Valley Senior Living. Yes, we do have pet therapy allowed to come in. We also have staff that are allowed to bring their animals to work there, and socialize with the residents.
I think we should all be doing it, I think, from the results I saw studying that. So yeah, I hope we do.
We actually even have a resident who has her own cat that came with her. So
Good. I know that, when I'm asking kind of what matters most to my patients, how often they say their dog who gets them out walking and who, greets them every day. So, or their cat who they are taking care of. Those are oftentimes what matters most to people, are their animals and pets. Yes, often I get people complaining that they can't have a conversation at their senior place because nobody can hold a conversation with them. I hear that. I don't know I think, at memory cares, they're still able to, go into one memory care, and they're engaging people. Sorry, the phone. Even though they're all in a difficult place. So I think you want to be able to get them to a place where they have people kind of on their same wavelength, but I don't know how we adjust for that. Some of that I think comes down to what activities are you doing to engage all those people and get them all involved. But it's hard, certainly because of staff issues too. Yes, the fake animals have been shown in studies to improve anxiety. I know a lot of with memory care, and the babies that have the true weight are also helpful. Well, like I said, a little short and sweet today. But hopefully you can spread the word just to be on the lookout. So we can try to come up with ideas and ways to improve loneliness.
Thank you so much, Dr. Dahl, for the great presentation.
You're welcome. Have a great day.
You too.
I'll stick around if anybody has any questions for a little bit, but
And just a reminder, the link for the evaluation is in the chat, so be sure to complete that. Okay. All right. Thank you so much, Dr. Dahl. Have a good day.